Gall bladder and bile duct cancer is a rare form of cancer that is difficult to diagnose. The early signs are non-specific and are common to many other conditions. Taking us through this discussion is Professor M Musibi, a medical oncologist at the Nairobi Hospital. Come with me.
I'm M Musibi. I'm a medical oncologist, meaning I treat cancers using drugs, whether they are swallowed or they are injected. Now, a gallbladder cancer is a rare type of cancer, and I want to imagine the reason you're saying people don't know about it is the fact that we, both us and media, hardly talk about it. We are used to cervix, we are used to breast, because that is where mostly advocacy has been. But should be known that we have a cancer month for the different cancers of the body. It should also be known that any organ in the body can get cancer apart from two, and because they are dead. That is the hair and the nails. They can get affected by the other cancers, but by themselves, they cannot get cancer. So going forward, I'm sure we should have discussions of a cancer every month, yeah? All the way until we get to the breast that we commonly know. That's a tricky question, because it also comes down to who are we as human beings, how is every other person created. We have what we call genes, but from what many people have observed, it is more in older women. A bit of it has been related to obesity, because most women, as we grow older, we also tend to gain a bit of weight. But there's no particular thing that will tell you it is women versus men. Again, it is the most confusing cancer as far as presentation is concerned, because most of what most people present with is vague symptoms. Majority will say, I started having abdominal discomfort, abdominal pain for long. So what happens is, within our health system or within the people themselves, they'll get treated severally for peptic ulcer disease or acidity. Some will even get treated for anemia, irritable bowel syndromes, and all those kind of things. But majority, the beginning is abdominal discomfort. Then they'll come to acidity, because what happens is there is reflux or return of the bile back into the gastrointestinal system. So that actually makes people get acidity. As the growth goes advances, then people tend to get yellowness of eyes, what we call jaundice. And eventually, there are many people that may present with features of liver failure, kidney failure, poor feeding, they are wasted, and eventually it's a bit late when they do come with those signs. So the most common one is a presence or somebody harboring what we call gallstones. In majority of patients, they have the gallstones and they may not cause any issues at all. But depending on the compositions or how long they are, how many they are, how big they are, there are people who tend to progress on to get the gallbladder cancer. It is thought that the persistent irritation of those gallbladders on the lining is what predisposes to cancer. We also have infections, things we call cholecystitis. If not treated very well, eventually the inflammation tends to become cancerous. People with liver disease, in a way or the other, they have been also shown to have a more increase in gallbladder cancer. In us, this particular thing that is related to gallbladder cancer, there isn't. I would say it is common, and come back to the fact that many sometimes also don't get diagnosed, because being in that small organ you call the gallbladder, there are many patients that may not eventually get to facilities where good radiological examinations can be done, and eventually may actually die without being diagnosed. But in the statistics that we have, I wouldn't say it is far from, it is not within the above, the top 10, but it is quite recognizable. That's tricky, but any of our behaviors that will tend to lead to weight gain, alcohol, smoking, most of those are eventually, considering they also alter the major body habitats and the GIT, the gastrointestinal system, they may also predispose. We have infections like hepatitis, which might actually come in with drug users, may also increase the possibility of getting the cancers. First off, is the person themselves knowing their body, yeah, and actually getting to know why all of a sudden am I getting these symptoms? Why am I all the time getting the acidity? I've not changed my diet, I've not changed many things within my life, day-to-day life. That will tell you something is not right. The second one is high index of suspicion, because when you come to the healthcare providers, then you're given, more often than not, you'll be treated for dyspepsia or hyperacidity. But if you're going once and going twice, then the healthcare provider should actually entertain a possibility of something else. Now that is where things like endoscopy, that is looking through the intestines or the way to the duodenum, where the gallbladder usually is attached, can be ordered. And more often than not, sometimes that may also not pick the problem. What it usually shows is the green stuff from the bile may be coming back into the intestines or back into the stomach. That should trigger the healthcare provider to think what could be the cause. Now, from there, we usually go to radiology, and we can start with what is called ultrasound. But depending on the size or where that particular tumor is, sometimes it may also miss. And when somebody is asked to do several of those radiological, from ultrasound to CT scan, sometimes to even doing what we call magnetic resonance imaging, it is the fact that sometimes it is too tiny that it cannot be seen. But diagnostic is from the symptoms, index of suspicion, and then the radiological examinations. Like almost every other cancer, treatment is a combined method. Okay? For gallbladder specifically, the best and if possible, the one that can give you a possibility of cure is surgery. And what that says is it has to be diagnosed as early as possible at a point that surgery can be done. Now, for those that may not have surgery for one reason or the other, we have the use of chemotherapy, that is drugs. And there are also others that may actually benefit from what we call radiotherapy. In majority of patients, they may have almost all those three modalities taking place. What we can't forget is the branch of medicine called palliative care, because it takes care of many aspects: pain management, the support of both the patient and the relatives, because the journey sometimes is not quite good. Like we heard from the beginning, many present quite late because of the delays that come along the journey. So the palliative care team also have to be involved right from the beginning. For management-wise, all these modalities are available in this country, both the drugs, the surgeons. We have a huge team of trained hepatobiliary. They are called hepatobiliary surgeons. We have the radiotherapy services. Well, suffice to say, we only have it now in Nairobi, but hopefully we should have it in a wider region, because the work is being done for that. Drugs are available. We also have the support for the National Hospital Insurance Fund. A few of the patients might be referred outside because a bit of the targeted kinds of surgery is still not available, things like we call cyberknife. But for the populations that we have seen so far, there is a very, very small number that presents at that age that requires only that specialized surgery. Yes and no, because if you are obese, you need to hit the road. Yeah? Knowing yourself, yeah, and having the normal regular checkups. Most of us Kenyans hardly want to see a doctor unless you are really sick. So most of us should be keen to know what is happening with our bodies and present early enough for checkups. Of course, we have the immunizations that are going on, and the children, the mothers should actually keep to the KEPI, because we have hepatitis B included in that schedule. The rest is the normal alcohol, smoking, which also complicates all many other cancers. Genetics we can't change. A woman has to remain the woman. But again, there are a few families that have different cancers. We should not forget that. And they may tend to have a higher risk of developing the same gallbladder cancers.